So my name is Zain Boghani. I'm a neurosurgeon practicing in Northern Georgia. I'm fellowship trained in complex spine surgery, spinal oncology, and minimally invasive approaches. Overall, I've had an excellent experience with Catalyst. I first adopted Catalyst by chance. I was impressed with the handling characteristics. I had been interested in synthetic bone grafts and thought that we could do the surgery better than what I was currently using, which was allograft. And so through multiple years and seeing my patients and the great outcomes, overall, my experience has been fantastic with Catalyst. Although rare, there can be transmissible diseases with allograft. The other question that I had was, how do we do quality control? Every human is different. And so how do we know that one sample of the allograft is the same as the next sample? And so I wanted some more consistency. What also is excellent about Catalyst is that there's no need to refrigerate it. So that was another concern. And adding all these things together just made sense for me to push towards a better solution in the synthetic space. The three words that I would use for Catalyst would be form factor and outcomes. Form factors is two words. So just speaking on that area, Catalyst is very moldable, excellent to pack inside of a cage, excellent to pack inside of the facet, excellent for packing the gutters. Outcomes, having used it for 3 years, it has very high fusion rates, and it's been validated with multiple studies in animals and human clinical trials and in spinal registries. I think the most exciting thing about Catalyst is that it truly is the way forward. Allograft is an excellent option, but it should be a thing of the past. You know, it was great when it was first designed, but now the future is synthetic bone graft. And so what excites me is that I get to be a part of the whole process. I get to do next generation surgery, the most advanced surgery, and that's what I like to offer my patients. In challenging cases with Catalyst, there's a less of a requirement for the use of growth factors. Growth factors are excellent at getting fusion, but sometimes, you know, they can have other side effects that weren't intended. And so being able to use them more sparingly and use Catalyst, which is quite helpful, and not having to rely on the growth factors as much. I would definitely recommend Catalyst to my colleagues, and I have spoken to a few of them and have converted them, and they're quite happy users of Catalyst as well. I think it's the overall handling, the outcomes, and the fact that it is a synthetic and immediately available. And so you avoid some of the rare complications of allografts. For someone who's prepping for their first case with Catalyst, I would recommend them to use it just like you would use allograft. You could literally, you don't have to change your workflow at all. It integrates very easily. The only thing that will be great is that you don't have to defrost your what you were going to use and packed with. This is immediately available. It's extremely handleable, so you'll be able to pack it in to any space that you want, and you'll have a peace of mind that it's going to stay there. And then you have the outcomes that are backing you up. We have the studies in humans that are spinal or registries, which are the best reflection of what we deal with on a regular basis.